and welcome to welcome to Hospitality Newfoundland and Labrador's Wellness webinar in collaboration with the Provincial Government of Newfoundland and Labrador, as well as Channel, a not-for-profit provincial organization created by and for individuals living with mental health and addiction issues. For those of you who do not know me, my name is Craig Foley, and I am the CEO of Hospitality Newfoundland and Labrador. We put together this webinar knowing that many people are facing challenges related to the pandemic, both professionally and personally. We want to address this and provide supports for you. Your well-being is important to us, and we hope you find value in the information provided today. Before we get started, I want to respectfully acknowledge the province of Newfoundland and Labrador and the ancestral homelands of many diverse populations of Indigenous people who have contributed to 9,000 years of history, including the Beothuk on the island of Newfoundland. Today, this province is home to diverse populations of Indigenous and other people. We also acknowledge with respect the diverse histories and cultures of the Mi'kmaq, Innu, and Inuit. I'm happy to introduce our presenters for this morning. Debbie Curtis is a provincial mental health and addictions consultant with the Newfoundland and Labrador Department of Health and Community Services. Debbie is a registered social worker and has a Bachelor of Social Work and a Master's of Business Administration from Memorial University. Debbie has worked as an addictions counselor with disability management consultant and in human resources. Megan Churchill is the Provincial E-Mental Health Manager for Newfoundland and Labrador. She works with the regional E-Mental Health Managers across the province to research, develop, manage, and promote the large number of virtual mental health supports we have in our province. Megan has a master's degree in social work and is a registered social worker. Barry Hewitt is the Systems Navigator in Mental Health and Addictions for the province of Newfoundland and Labrador. Barry has a BSc in psychology from MUN, a BSW from Dalhousie, and a master's specializing in addictions from the University of Toronto. Barry has over 25 years as social worker throughout the province and in Nova Scotia. Brad Glynn is the executive director of Channel, a mental health and addictions organization operated entirely by people with lived experiences. Throughout his life, Brad has lived with anxiety, depressive episodes, and other mental health issues. Before joining Channel, he was an educator for over 10 years, and in this role, always prioritized the mental well-being of his students. In addition to his work with Channel, Brad volunteers extensively in his community, including past experience as the chairperson for Happy City St. John's. Currently, he serves on the board of End Homelessness St. John's and is the provincial president of a local sporting organization. Welcome to all of our speakers this morning. We are going to record this session for YouTube, but at the end of the presentations, we will have time for some Q&A, and we will not record that portion in order to provide a safe space for anyone wanting to ask questions. I'd now like to turn things over to Debbie to get us started.
Good morning, everyone. Thank you, Craig, for a lovely introduction. As Craig said, my name is Debbie Curtis, and I've been the Provincial Mental Health and Substance Use Consultant with the Department of Health and Community Services, and I'm very pleased to be joined here today by my three colleagues, Brad, Megan, and Barry. I wanted to start today just with a reminder, that during today's session about mental wellness, we are going to be talking about some topics which may be sensitive for some people. If at any time during today's webinar you feel that it's become challenging for you or you need to take a break, feel free to do so. If you need support, please feel free to call the Channel Warm line, which is the numbers available here on the screen, toll free 1-855-753-2560, or in St. John's area 753-2560. And just to remind people that this line is operated by people peer support workers. It's available 7 days a week from 9 a.m. to midnight. So if not during today's session, but if afterwards you'd like to touch base with someone, feel free to do that. So like Craig, I'm very delighted to be here this morning to have the opportunity to work with Hospitality Newfoundland and Labrador and its membership. We certainly recognize that the pandemic has impacted everyone in our province and certainly the world. And we've also like to acknowledge that some of the groups impacted have been impacted more than others. And I often think about, of course, our frontline healthcare workers, also the community organizations working with people who are homeless. And certainly people in industries such as yours. You've been very hard hit, not only financially, but also impact on your staff and your life's work in some areas. And I'd just like to say that, we're so grateful for your sector, for adhering to the guidance that you've done to keep patrons and guests safe throughout this experience, and for being there for all of us during such a difficult couple of years. I know that your presence in our communities has helped us with our mental well-being so that we could continue to do things that we enjoy and pretend that things were normal again. And things like sharing a meal with family and friends, listening to a few tunes, or seeing a show, all those things are really beneficial to our mental well-being. And you've contributed to that, and we thank you. Hopefully today's session is our way of being there for you and for your teams and your staff. And what we'd like to do today is to provide you with an overview of mental wellness strategies and provide some real tangible tips for you to not only for yourself and your families, but also for your teams. We're also going to give an overview of the provincial e-mental health programs available, and many of these are available 24/7, and our provincial mental health and addiction services throughout the province. And we'll also at the end have time, as Craig said, for some questions. We'll shut off the recording for that and be able to hopefully answer some of your questions. But if not today, people can certainly feel free to reach out to us after today's session. What I'd like to do just to get us started is just a little context on the national scene. There's been, during the pandemic, I always say that this is going to be studied now for the rest of our lives. We're going to be talking about COVID and the impact on all kinds of things. But over the last couple of years, the Mental Health Commission of Canada and the Canadian Centre on Substance Use and Addiction have worked together to establish surveys and polls with a group called Leger. And one of the most recent ones was focused on youth aged 16 to 24. And so this group, some of you may be in this age group, but also some of your staff certainly would be. And they found that mental health and substance use has been impacted by the pandemic, and it's no surprise to any of us, of course. But this age group did report quite an increase in their reaction for depression, but also severe anxiety. And you'll see here that 24% reported moderately severe or severe depression, and almost double that reported moderate to severe anxiety. As well, the rate of people reporting suicide ideation was at 17%, which is quite concerning. When it came to substance use, you'll see also that alcohol and cannabis use were reported to have increased as well. So 37% in this age group reported increased alcohol use, and 45% reported increased cannabis use. And very often people turn to substances due to loneliness. They may be dealing with stress, financial concerns, family issues, work concerns. So these numbers are very concerning to us. Also, so as I said, there's been a number of polls done by this group for the Mental Health Commission of Canada and Canadian Centre on Substance Use and Addiction, but they also found that mental health and substance use issues were greater among females in households with young children, and those were children under 13 years of age. And a third of people surveyed talked about increasing their alcohol use, and about a fifth of those, 2 in 5, reported high risk alcohol use. Similarly, in this broader age group of adults, 2 in 5 consumed cannabis more and became problematic use. So these are studies that were done on a national basis. We haven't done any particular Newfoundland statistics, but we can anticipate that this would be very similar in terms of our experience. So I'm going to turn it over to Brad now to talk about mental wellness and tangible tips for you and for your employees.
Thanks so much, Debbie. First of all, thanks everyone for having me. Again, my name is Brad Glynn, and I'm the Executive Director of Channel, which is the Consumer Health Awareness Network of Newfoundland and Labrador. And I appreciate your time today. And as Debbie echoed, we want to thank everyone for the service your industry gives our province, and we want to recognize it's a difficult time, and we're happy to be here to support you in it. Slide, Debbie. Slide, Debbie. There we go. Excellent. So a little bit about Channel before we get into what I'm going to discuss. Channel was founded in 1989 by a group of people with lived experience who simply felt that the mental health landscape in our province needed improvement. It became its own independent not-for-profit in 2006, and we're located across the province. We've got offices in St. John's, Mount Pearl, Marystown, Grand Falls, and Stephenville, and we've actually got staff from here to Happy Valley Goose Bay serving in a variety of capacities. Slide. So who we are, you can run all that down, Debbie. I'm not sure why that's doing that. We're the only provincial organization run strictly for and by individuals living with mental health issues. So we have 34 people on staff, and all 34 of us identify as living with mental health issues, a mental illness, or a substance use issue. As Craig said in the introduction, I live with generalized anxiety, major depressive disorders, and my depression largely manifests itself in fairly strong thoughts of suicidal ideation and other issues, which has been pretty prevalent in my life since about the age of 13 or 14. So I've grown up with it, and it's kind of just a part of who I am now. Our organization provides peer support, which is probably what we're most well known for. And just like Bridge the Gap, we thank Dr. Fitzgerald, Minister Haggie, Premier Furry, Premier Ball before him for highlighting the warm line throughout the pandemic. And our mission is to advocate and bring awareness to issues that need public attention, particularly related to destigmatization of people living with mental illness and substance use. And we do a lot of work to combat NIMBYism as it relates to issues in communities and more systemic issues. Slide. And now into the more tangible stuff. What do we offer? We offer in-person peer support groups. Right now they're on hold due to the current restrictions, but we usually hold those about twice a week. We hold them in all our offices across the province, and those are usually related to very specific strategies. So peer support is offered by people with lived experience, and it's not about delving deeply into trauma you've experienced. It's not about diagnoses. It's about recognizing that if my mental wellness or my mental illness or my substance use issue is affecting me, that I need to come up with tangible strategies. So our sessions might be about communication, they might be about self-care, they might be about being understanding, they might be about self-advocating for ourselves with our loved ones or within the healthcare system. We also offer in-person one-on-one peer support, which are about 30 to 45-minute sessions, not unlike the 50-minute hour that a psychologist might have. But again, done from a peer support lens, which is very person-centered, very much about what are the issues, what are the things going on in your life right now, and how can we come up with some concrete strategies to address those. What a peer supporter does that's unique from a psychiatrist, a psychologist, a social worker supporting someone, is we use our own stories to help inform what we do. We're all about encouraging people to hope and dream, and examples from others of how they got through periods of depression, periods of financial difficulty, periods of relationship issues are often empowering to someone because it allows them to see a way forward, a way through. And our one-on-one peer supports really provide a deep dive to that. And then we have our warm line, which again is our most well-known service. In a moment, I'm going to put the information into the chat again. but it's 1-855-753-2560. And when you call our warm line, you can get a caller, but we've got 2 active lines, so you often have to leave a message and you'll probably get a call back within 10 or 15 minutes. And the warm line is a spot just to have a 10, 20, 30-minute phone call with a peer supporter. And it can be, you need just someone to talk to. You've had a bad day, you want to have a conversation. It could be something related to a mental illness and you feel your medication isn't working great. It could be that you're struggling with substance use and that you're trying to find the courage not to have a drink that day. It could be you've had a drink that day and you're feeling guilty about it. And so the warm line is a pre-crisis support. Our province has the wonderful crisis line, which I'm sure will be talked about later. So the warm line is kind of before that moment where a crisis occurs and is meant to just offer people support to figure out a solution to get through a day, get through a week. And that's open 9 a.m. to 12 a.m., 7 days a week, 365 days of the year. And our peer supporters are always happy to be there to talk to someone. We do offer a little bit of electronic peer support. We are piloting some texting projects. We're piloting some other things. During non-pandemic times, we also offer wellness workshops, which are more specifics. It might be art-based, it might be exercise-based, just teaching people strategies of how to improve their wellness. And that's a lot of what I'll talk about today. And some other things we do is we support others in establishing peer support groups and finding a safe space to create community and share your voice. And a lot of that work might be with people in rural Newfoundland and Labrador, where we might not have an established presence, but someone with lived experience reaches out to us and is looking to establish a group. So we might put them through some training. We might help advertise it so that that support is available. Slide. So what do we offer? We offer public education and policy consultation. Those are the other 2 items that we have accessible to people in our province. And I won't delve too much into those, only to say that if your group or specific individuals ever want to do some of our public education, it is all delivered through that lived experience lens. That Today and Tomorrow too is our peer support training, which trains our people who eventually become certified through mentoring and in a period of time. And we offer mental health first aid. And we also offer something called the recovery approach, which was developed with the department, which is really about teaching people within the system what it means to have a person-centered mental health approach. But it's a really great tool for destigmatization. And slide. So as Debbie said, they asked me to talk about what is mental wellness and mental health and what are some tips. So first of all, mental wellness is not always about being happy. What it really is about is it's being able to self-regulate. It's being able to handle the emotions and the thoughts we face in our day. And when you're in a period of good mental wellness, it's about being able to get through the stress that you face in your life and face it in a way that's appropriate without falling into some coping mechanisms that are probably a little less helpful, a little less beneficial. So our mental wellness is just that state of how we are doing every day. And it's affected by a host of factors, first of all, our genetics, our neurology, and things, but then also our physical health, our past life experiences, those things we carry around with us, our living circumstances and events in our everyday life. And we understand right now, particularly in your industry, that there's people struggling with staying employed, with ensuring their employees are receiving a paycheck, worrying about what's to come down the road, and that those things affect us. And we would always encourage people to face those things. It's so easy to try to push those to the side and not pay attention to them because they are big and heavy, but acknowledging them in a healthy way and acknowledging that you need to do things to support yourself is so important. And the big question is, what affects our mental health? What affects my mental health is often different than what affects someone else's mental health. For example, I don't struggle with uncomfortable interactions, with someone being angry with me, with someone being disappointed in me at all. I can receive that and it doesn't throw off my whole day. It doesn't cause self-doubt. It doesn't cause any disordered thinking. But for someone else, that sort of interaction might have an impact that lasts a day or weeks. So taking that time to say, what are those things that positively promote strong mental wellness for me? And what are those things that negatively impact my mental wellness? And honoring the fact that we're all different there. And then the final point there is just a reminder that mental health and mental wellness is not equivalent of mental illness. I can go through a period of poor mental health, and that does not necessarily mean my mental illness is a part of that. And someone can live with fairly pervasive mental illnesses, and their mental health can be in a great place if they're taking care of their self-care, taking care of coping strategies. So these two things often play together. Often when my mental illness, when my depression is affecting me greatly, my mental wellness does dip, but it's not a correlational thing, and it's not always a causal thing. And that's one of those destigmatizing points, because we can forget that at times. Slide. So, types of stress. You know, it's important that we realize in our lives before we get into strategies that there's healthy levels of stress in our life. There is stress that promotes positive behaviors, that increase focus, that increase our passion for things. And that sort of stress is largely what drives us as professionals. You come in, you've got a new project, you've got a new idea you want to do, you've got something you want to achieve, and that stress is really, really positive. And then there's that stress, de-stress, which isn't that. And I think what we've seen in Debbie's stats that she raised and showed, and you can find lots of surveys by Leger and by other groups that illustrate that, is that what we've seen over the past 23 months is there's more and more people arriving at a de-stress point where they're in their comfort zone, it's getting stressed, and we started to hit that strain, right? We were all likely hitting that strain in the summer of 2020, and here we are now 18 months later. So that stress, even if it was at once a positive stress, can only be maintained for so long. It's that elastic band effect that stress can lead to burnout, it can lead to lack of self-care, it can lead to inappropriate coping strategies or not beneficial coping strategies, and that at our current time and in our current reality, things that were once probably positive stresses are not positive stresses anymore, because our capacity to handle those things just isn't the same. Something we continually say around our office is we need to remember nobody is working at capacity right now. So honoring communication, ensuring that we're being gentle with ourselves and with each other is important. And remembering that stress is not always a negative, I think, is really critical as we consider what self-care and what tangible tips for mental wellness look like. Slide. So how do we handle that stress? You know, there are the ones that are constantly reminded of in our world. We need to pay attention to what keeps us mentally well. And some of these are so common that they're almost cliche, but it's important to name them because we can often forget them. What are we putting in our system? You know, what foods are we eating? Are we getting natural vitamins? Are we getting nutritious food? Are we drinking enough water? Are we making sure that our caffeine intake isn't more than it should be, or could be? Are we making sure our alcohol intake or our cannabis intake isn't more than what it could be? If we choose to use other types of drugs for medication or self-medication, are we sure we're using those in an appropriate way? Exercise and sleep. You know, the exercise one is so well known. Finding the time for that can be difficult in today's world, and finding the place for that can be equally as difficult in today's world. But ensuring that we're moving our body, and something really important with stress is a walk is great, and a walk can get out stress. But at times when we're feeling very compacted, very inside ourselves, and that stress is taking over, you almost want some sort of vigorous physical activity to counteract that, whether that's weight training, whether that's going for a jog, whether that's getting on a row machine, because that literally gets some of that stress out. And sleep, you know, something that I think almost everyone could improve on in ways that one of the best ways to give our brain and our bodies and our systems rest is to sleep and ensure we have a consistent sleep pattern. Taking breaks, you know, making sure on our day we're getting up, we're walking around, we're doing those ergonomic things, but also annually. In your field, I'm sure now so many of you are just trying to keep your businesses afloat that it's probably been a while since you took even 3 straight days off, 4 straight days off, a week off, 2 weeks off, but realizing that time is probably going to add value down the road is important, and finding ways that are realistic to do that even in this difficult time are important. Fostering positive relationships. There are people who feed us, and there are people who make us feel better, and there are people who ease the burden. And unfortunately, there are people who do the opposite. And ensuring that we foster those positive relationships, seek them out, listen actively to someone, speak actively and honestly with someone is so critical to keeping that community, which is so important in Newfoundland and Labrador. And then social media and screen time. You know, we're all attached to our phones in today's world, but again, using those appropriately and using those in ways that support us in our mental wellness and don't allow us to use it as a crutch. It is a passive activity and therefore allows our mind to wander, therefore allows stress to fester. So what coping strategies can help you? You know, that's a question that's different for everybody. A coping strategy for me is not the same as for you. And I think honoring that and recognizing that and sitting down and making a list of what actually helps me, because maybe a run isn't for you. Maybe talking to a friend on the phone isn't for you. And it's important not to feel like you need to do that. On my next slide, I'll talk about that a little bit. And then what if our coping strategies aren't working? You know, we're all pushed to the brink. We're 23 months in. What then? You know, the first thing to do is acknowledge that you're struggling. And that's tough. I've lived with mental illness for 23 years now, and it's still tough to lay in bed on that morning when I know things have gone astray and say, okay, I'm not good right now. I need support. And being gentle on yourself as you do that. It is not a moral failing. It is not a character flaw to struggle and to have a difficult time and to not be as productive as you could be and to maybe be a little bit short with people. We're living in a surreal time, and acknowledging that's important and reaching out for support. And that might start with your closest loved ones. If you're not comfortable with that, it could start with something like our Warm Line, which is anonymous. If that's not for you, it could be going on Bridge the Gap, which will be highlighted in a little bit. It could be reaching out to a psychologist. It could be talking to your GP about the fact that you're struggling. But doing what works for you is what's so important, and honoring that. Slide. So I just talked about all these tangible things that we can do for our wellness. And in some ways, we're inundated with that stuff. You know, if you look at yesterday in Bell Let's Talk Day, there's so much positive shared about what we can do to support our mental wellness. Something at Channel we always promote is eliminating the word should. Because as soon as I say, I should have a salad with supper, I should get 2 liters of water in me a day, I should get for a 20-minute run, I should make sure I speak to someone in the next week to have a positive conversation, I've just added to my to-do list. We're already all over capacity. We've already got lots of stress in our life that is likely burning on strain and burnout. So making our wellness strategies shoulds isn't really productive, and in a lot of ways it's counterproductive. So making that mental wellness list a list of coulds. I could go for a 10-minute walk today. I could call my mom and have a chat with her. I could just sit and read a book for a while. And then ticking off the ones you achieve with gratitude and being gentle with yourself about the ones that you don't achieve, because shoulding can really simply exacerbate this problem and make us seem as though we've just got more things that we're not getting done. Slide. And this is our final slide for me. And it really is just what are effective and realistic self-care strategies. As Craig said in my introduction, I was an educator. My last classroom was a kindergarten classroom. And this is actually a list I would use with lower primary students. You can see declutter old toys, you can see kids yoga. But I really feel that effective and realistic self-care is simple. And it is easy, and it is about joy. It is about release. It's about being able to lower our shoulders. It's about being able to bring our tongue away from the top of our mouth. And it's being able to take that big breath and just let it out. And these are just examples of really simple, joyful things that we can do. And they highlight the 6 ways we need to, or we could, focus on our mental wellness, our emotional wellness, our physical wellness, our spiritual wellness, our mental wellness, our practical wellness, and our social wellness, because those are all different areas, and at times likely we're focusing more on some and less on others. And effective and realistic self-care is about finding items such as the ones on this list and engaging in them in ways that can and could improve our wellness. And a reminder that if there are times you need support or you feel you want support in maintaining your wellness, or you're struggling to do that, the Channel's Warm Line and our peer supporters are there to help, as are the other services in our province, which will be spoken about by our other presenters. And slide, and I think that's it for me, Debbie. Thank you so much.
Thank you, Brad. Thank you for the wonderful reminders that we could all listen to. And I love the stop shooting yourself. That's really so important. Thank you so much. Next, I'm going to pass it over to Megan, who's going to share with us today about our Provincial e-mental health suite of services.
Thanks, Debbie, and thank everyone for having me today. I'm going to review many of the e-mental health services we have available in the province. I won't be able to go through all of them, but I will spend as much time as I can doing an overview about ones that would probably be most beneficial to you. And I just want to let you know that there is an e-mental health manager in each of the health authorities across the province. So if you have any questions, you can certainly reach out to me or any of the e-mental health managers with the other health authorities. And if you're looking for their contact information, you should be able to find it on Bridge the Gap, or you can connect with Barry Hewitt, who's going to be presenting with me after this part. So why do we use, slide Debbie, why do we use e-mental health services and addiction services in the province? E-mental health provides high quality support and services based on extensive research and best practice. It's not designed or intended to replace in-person services if they're needed or preferred. It just gives people more options and enhances access to services when and where they're needed. As Debbie had mentioned earlier, many of these services are available 24/7, and it also encourages people to get support early to help minimize the impacts of mental health issues on a person's life. A bit of the silver lining with COVID is that we had many e-mental health services and virtual care options available before the pandemic. And in many ways, we had an advantage in mental health and addictions because we had these options available to provide people while they were at home or while they weren't able to work. So I'm going to get into what Bridge the Gap is. I'm sure many of you have heard it before. And if I get a chance at the end of the presentation, I will show it to you. Slide, Debbie. And Bridge the Gap is our go-to provincial mental health and addictions website where you can find all of our online mental health services and information within the province. The site is divided into a youth section and an adult section. It's available at no cost and you can use it on a computer, a tablet, or your phone. Other provinces also use Bridge the Gap though, so I just, when you log onto the website, make sure that you select Newfoundland and Labrador as the region. It will pop up if you're on a tablet or a phone to select your region, but there is a Canada site as well. But our Newfoundland and Labrador website has significant programming and information on there that's not available on some of the other sites. Slide, please, Debbie. So some of the features on Bridge the Gap include a service directory, which is where you can find and locate mental health and addiction services in your local area in the province. It's broken down by each health authority. And that section will also give you information about the health authority programs, as well as community agencies in the area that serve mental health and addictions clients as well. There's a knowledge center in the adult section and an information booth in the youth section, and they contain information about a variety of mental health and addiction topics like stress, depression, suicide, bullying, substance use, and parenting, to name a few. We really try to have an A to Z topic list for that section, and we're continuously adding information there as well. Then we have the Get Inspired and MySpace sections, and those areas provide people with a way to explore your creativity. You can post art that you've done, a favorite book, coping tips that you found helpful, and you can also read about other people's mental health journey and strategies that have worked for them. The online program section, which is a lot of what I'll cover in the presentation, includes wellness webinars and links to actually access many of the free online programs that we have. The webinars that are listed there are facilitated by clinicians in our province, and they offer great information and tips on how to deal with a variety of issues. So I think off the top of my head, there's ones there for stress, anxiety, parenting in a pandemic, how to engage in self-care in a pandemic, and grief and loss as well. And again, we're adding to that section pretty regularly too. And then the last part, a feature on Bridge the Gap, is the Toolbox, and that provides links to self-help activities. So for example, there's a list of wellness apps that you can access. There's tips on how to stay physically active. They have relaxation strategies listed in there, as well as some mindful activities that you can do online. So like I said, if I get time at the end of the presentation, I will go into Bridge the Gap to show you. I know we hear a lot about it, but I think there's value in actually visiting the website and showing you where everything is located. Slide, please. And the next slide after that, actually. So the first program that I'm going to talk about is Therapy Assistance Online. TAO is what it's called for short. And TAO is an online internet cognitive behavioral therapy platform with a wide variety of programs that are tailored for people 16 and older. And if you're not sure what cognitive behavioral therapy is, it's an approach that's used in counseling to treat many mental health issues, such as anxiety, depression, and addictions. There's a ton of information on TAO, and they have wonderful, amazing coping strategies there that you can watch and read and listen to and incorporate into part of your self-care routine. TAO right now is currently available to over 1 million individuals in both the US and Canada, and it is heavily used in our province. And we actually have 2 ways that you can access it. So you can access it as a self-help, which is available just to go through Bridge the Gap, and you sign up with your email and you can log on and go through all the content on your own at your own pace. Or you have the option of completing it with a clinician. So you would do some of the material on your own. You'd watch the videos throughout the week. That's convenient for you at a time that works. And then you would meet with a clinician either in person, over the phone, or by telephone each week for about 4 to 6 weeks. And you would be able to access that service with the clinician by making a referral to your local mental health office, or contacting Doorways Clinic, or going to a Doorways walk-in clinic. Next slide, please. So Check It Out NL is another service that we have available, and it's an anonymous self-screening tool for anybody over the age of 18. If you're concerned about your mental health, or even the mental health of a loved one, you can complete a screener for a variety of topics like anxiety, depression. There's screeners there for PTSD, eating disorders, substance use, and they also have just a general well-being screener just to see how you're doing overall. And completing screeners can be a great way to check in with yourself, and a really quick way to determine if you should connect with a professional, or if you need to take any additional steps to manage your mental health. The screeners are completely anonymous, like I mentioned, and they're confidential, and you can complete them as frequently as you would like. I will say these are not diagnostic tools, so only a trained professional can diagnose you with a disorder, but they can help people determine if they're experiencing a symptom or one of many various disorders. And what happens at the end of the screener is you're provided with resources to other mental health services if needed. So you might give a link to your mental health and addictions office, or some links to Bridge the Gap channel. They'll help connect you to other services if you want to reach out. Next slide, please. Mindwell U is another program that we have available through Bridge the Gap. Mindwell U is a Canadian health tech firm based out of British Columbia. They offer mindfulness training online, which includes lots of webinars. They have, I think, over 30 webinars there about mindfulness in various contexts. And they also have a 30-day challenge. So the challenge is unique because it teaches people how to be mindful in action. Obviously, during the pandemic, we're all very busy. We all are kind of stretched thin. And with this app here, you can actually learn mindfulness strategies by only participating in it from 5 to 10 minutes a day. It's a video link that you'll get to watch, and then they will give you some tips that you can actually practice throughout the day after you watch that video. Mindfulness has lots of benefits, including better emotional regulation, better focus, lowers your stress, just to name a few. And anyone can benefit from mindfulness, not just people who might be experiencing a mental health issue. I'd actually recommend everyone attempt using mindfulness strategies in their self-care routine as a preventative way of maintaining a positive mental health. And the 30-day challenge is a great way to just get introduced to mindfulness if you've never tried it before. The challenge in itself, you can complete alone by yourself, or there's a feature you can actually sign up with a buddy. And you can do that again by visiting Bridge the Gap online program section. And I will say, we've had lots of creative ways that Mindwell U has been used. Some of our teams within Eastern Health actually did a challenge together. So they all signed up for the Mindwell U 30-day challenge. And then in the morning, every day, they'd get together for 30 days for about 5 minutes and watch the video together. And it's a great way to build team morale, but also working on their own individual mental health and giving themselves a good start to the day. Next slide, please, Debbie. So Strongest Families is a not-for-profit corporation, and they're based out of Nova Scotia. They provide evidence-based services for children, youth, and families. They have telephone and online options for people between the ages of 13 and 17 and their families who are experiencing behavioral or mental health problems. So the Strongest Families programs are 12 to 17 weeks, and they're individualized based on cognitive behavioral therapy again. And families receive skill-based information either through a handbook that you can get in the mail or a login key online. And they get around 30 minutes of weekly telephone coaching from a trained Strongest Families coach. Next slide, please. So Strongest Families have several programs. The first one that I'll talk about is the Parents Empowering Kids. That's for behavioral difficulties for children between the ages of 3 and 12 years old. And this program helps parents learn to deal with common childhood problems. So it would be things like temper outbursts, not listening, verbal, physical aggression, difficulties paying attention. And I think, if you consider all the changes children are going through with the pandemic, being in school, out of school, caregiver changes and things like that, you might be seeing a bit more of these behaviors in that age range. And this particular program could certainly help with new ways of dealing with those behaviors, especially if they weren't maybe present before the pandemic as well. The Chase Worries Away and Defeat Anxiety are the anxiety programs that we have for 6 to 17-year-olds. And those programs educate parents, children, and youth about anxiety and teaches them relaxation skills and how to manage worry and face the worries in real life. They typically deal with issues around separating from a loved one or worries about performance in school, as well as specific fears. And then the other program they have is Bedwetting Dry Nights Ahead is what it's called. And it's for children between the 5 and 12 years old. And that's a group-based parenting program, which parents would meet together on a phone call with a coach, and they would work through some skills that can help their children resolve bedwetting. So these particular programs can be accessed a variety of different ways. You can self-refer directly by calling Strongest Families. You can visit their website or go on Bridge the Gap to find the information. You also can have a referral put in by a family doctor, your nurse practitioner, if you're involved with a mental health counselor, and even school teachers and guidance counselors are able to make a referral to these programs on the family's behalf as well. Next slide, please. The last Strongest Families program we have is the I Can Conquer Anxiety and Nervousness, which is a program for anyone above the age of 18, and it helps learn skills to overcome anxiety and cope with major life stressors. As you can imagine, in the pandemic, there's been a lot of life stressors that can happen, whether they're financial, relationship issues, increase in anxiety. And this particular program can be completed in about 3 or 4 months, and it can be accessed very quickly. Typically, once a referral is made to Strongest Families, they will get in contact with you to do your intake within 72 hours. The program can be completed by yourself. If you want to do it completely on your own and not with a coach, you can. You can do it at your own pace and sign in on your own and go through the materials. Or if you'd like to do it with a coach one-on-one or in a group format, you can connect with Bridge the Gap and sign on for that program there, or you can call Strongest Families directly and they will connect you with the coach or the group that you're looking for. Next slide, please. So the Breathing Room is another program that we have available. A Breathing Room was developed by an Alberta organization called the Canadian Institute for Natural Integrated Medicine. It was in collaboration with a couple of universities out west, I think University of Calgary, Mount Royal University, as well as Alberta Health Services, and over 100 young people also participated in developing the program. It's an 8-module program, and it takes about 1 to 3 hours a week to complete. However, you can complete it at your own pace. If it takes you, 4 months to complete, if it takes you 6 months to complete, you will always have access to the program. You can do it at your own pace. It was clinically tested to reduce depression severity for people amongst the ages of 13 to 24. However, I will say there's been people who have been older than 24 who have accessed this program and still found the skills and resources in there really helpful. Again, that program is free of cost. There's no referral required. You can just sign up through Bridge the Gap and log in right away and start using it immediately. Next slide, please. Another program we have, a new one actually, that's come out, is called Breaking Free. And that's an online program for people 16 and over. It's a self-help program that allows you access 24/7 on any device. And it's proven to be effective at helping people cut down on drinking and drug use or quit completely. The program is completely confidential. There's absolutely no waiting time to sign up for it. And you can immediately start working towards your personal substance use goals, whether that's to reduce your use, cut back on certain amounts of use, or completely abstain. The program will help tailor what those goals are for you and help you work towards them. Next slide, please. So now I'm going to get into some of our helplines that we have available in the province. And the Smokers Helpline has been around for quite some time. And I will say Newfoundland has the highest smoking rate of all provinces in Canada, and tobacco use and secondhand smoke contribute to about 17% of the deaths in Newfoundland and Labrador. So this line is very important for our population, for anybody looking to lower their smoking rates or quit entirely. They offer their services by phone, email, or text, and they have a lot of interactive tools on their website, as well as a web app that you can use called Kick Ash. They offer an online chat and a group program to help people quit smoking. They have tons and tons of resources and tips and strategies to reduce your use and quit on their website. But they are around for support, and again, can be accessed regularly on their website if you have any questions or if you're looking to quit or reduce your smoking. Next slide, please. The next helpline we have is the Mental Health Crisis Line, and that is available, free confidential telephone line 24/7 for people who are experiencing any mental health crisis. And that line is actually staffed by local clinicians here in our province, and they will provide you with crisis intervention as well as referrals to local services if you need. And they can also direct you to some of these online programs if that would be beneficial as well. Next slide, please. We also have the Kids Help Phone, which is free 24/7, anonymous helpline for children, youth, and young adults. So those who are looking to connect to professionals can call by phone. They also have a live chat option, which is the most heavily used option online. And they have a chat app that you can download. And Kids Help Phone helps support young people with a variety of issues across our country. So they will help kids with bullying, stress, relationship, anxiety, you name it. I remember one of the Kids Help Phone employees had told me that they had a 5-year-old call because they were crying because they couldn't find their teddy bear. So they've had all sorts of reasons why people are calling and are able to kind of help in any moment, big or small. Next slide, please. Next, we have the Gambling Helpline in the province. This is a provincial line, and it's available 24/7. And it's for anybody who's experiencing a gambling problem themselves or the negative effects of gambling, or it could be for somebody who is concerned about a loved one or a friend that might have a gambling issue. And the helpline will provide you with some education information about gambling. They'll give you resources that you can use, and they also will provide crisis intervention as well if needed. Next slide, please. This is a national line. It's the Hope for Wellness line, and they offer immediate mental health counseling and crisis intervention to all Indigenous people across Canada. It's also available 24/7. You can call the crisis line or the First Nations Hope for Wellness line 24/7, or you can visit their website. They have a chat box that can connect you with a culturally competent counselor online. They also provide counseling in both English and French, but on request, they can provide it in Cree, Ojibwe, and Inuktitut as well. Next slide, please. Crisis text line. So the crisis text line is a national line as well, and it's powered by Kids Help Phone. However, it is for children, youth, and adults. Anyone of any age can utilize this crisis text line. You can be 5 or you can be 65. And you just text TALK to 686868 to connect to a crisis volunteer, and they will help again with any issue, big or small. They also developed a text line actually for healthcare professionals and essential workers during the pandemic, which many of you would have essential workers. This line is called the For the Front Lines, and it can be accessed by texting Frontline to 741-741. And some reasons people may reach out to the crisis text line are because they have high stress, they might be having a panic attack, they could have had a fight with their partner, having issues or thoughts with self-harm or thoughts around suicide. Maybe you recently lost someone or a loved one, you're dealing with grief, anger, fear. Basically, if you're looking to talk to an unbiased trained professional and you're looking for some coping tips or to get connected to local services, the crisis line would be able to assist with that. And then lastly, we have the Provincial Helpline 811. I'm sure many of you have heard about 811 with COVID. That is our experienced registered nurses who are working that line very, very hard and very worked, I would say, at this point with the pandemic. But they also provide information around health services in a person's area and answer lots of questions about health-related topics. So not just for COVID, they can help you manage your physical and your mental health, as well as the physical and mental health for your family. If you have questions at all around anything with mental health, looking for a particular service, you are able to connect with them as well. And they do have a poison control option and a dial a dietitian option. So you can connect with a dietitian for free and to help you make any kind of healthy decisions around food, or if you have any nutritional questions. For example, if you're struggling with low iron and you would like to know how to increase your iron with different foods, you can always connect with the dial dietitian through 811. You can actually email them as well through the 811 website. I think that's it for now. Debbie, I'm wondering if I have time to show Bridge the Gap.
Sure, you can go ahead, Megan.
Okay, just one second, yeah. Are you able to see that, Debbie?
Yes, sorry.
Okay. All right, so this is the Bridge the Gap website. When you first log onto it, it's going to come up as the Canada website. So you just need to change your region to Newfoundland and Labrador, because that's going to give you access to all the programs that I just highlighted. When you go into it, you're going to notice the mental health crisis line is listed right up here. If you are in a crisis, you can contact them right away. That is our local provincial mental health line. And then you have a choice to go on the adult side or the youth side. So I'm just going to go on the adult side. And I will say a lot of the content and information is very similar on both sides. Just, for the youth side, it might be worded differently to make it more age appropriate. And they might have some more information tailored specifically for youth issues, like bullying in school, self-image, and that kind of stuff. So once you click the adult side, you'll have your navigation bar up here. So the service directory is where the programs you can find in the community, and it's broken down by your health authority. So if you click one of these, I'll click the Eastern region. You'll then go into a list of A to Z services that are available in your area. And all of these services are mental health and addiction services within the health authority, but also within the community itself. The Knowledge Center is that A to Z list that I mentioned with all different types of health topics. So we'll go into the anxiety section. I'll just give you a sense of what that looks like. Usually you'll have a video that pops up that you can watch. And then we also have some common questions that get asked that you can click into to find some answers. Then we have a section for additional videos. There's links out to reputable websites where you can find accurate information about anxiety, and then some articles that you can read as well. Then next we have the Get Inspired section. And this is where I mentioned you could be creative. So you can post art, books, coping tips. And I'll just go into the coping tips section here. So these are people in our community who would have posted things that have worked for them. So you can see here going for a walk with friends, talking to my mom and dad, practicing deep breathing. There's pages of these types of strategies that are listed. So even if you just logged on to Bridge the Gap and not any of our online programs, you certainly could find some other strategies that other people have used during these times to help with managing stress and their mental health. Another section that's there is the Wall of Hope, where people are able to share their stories of their mental health journey and their stories of recovery. So you can see some of these here. And this section, I think, is really beneficial to just making us aware that we're not alone. Lots of people have gone through similar struggles that we have. And then you're able to read those, and it helps with understanding that you're not alone, and it reduces the stigma that can sometimes come with going through maybe a mental health episode or an issue. Next, we have the online programs section. And this is where you can find all the programs that I had just talked about that I said you could sign up for free. So you'll notice there's a sign up for free button. You just click that and you fill in your information. You'll get an email that goes to your email address, and then you can access the program right away. And then lastly is the Toolbox section. And this is where you can find some of those mindfulness strategies I talked about, relaxation activities, wellness apps. And we also have a mood meter there. So you can go into this and use the mood meter to check in with yourself. So you get a list here of different emotions. I feel anxious or I feel stressed. You can rate what your level of stress is. We'll give it a 5, and then it will give you some information around stress, and then you get coping strategies, some stress relieving videos that you can do right there and then, as well as the connection to the coping cards and tips for coping. So that's Bridge the Gap. It's a lot of information, and we have a lot of online programs. I would just suggest if you have any questions, you can always visit this website. And again, Barry Hewitt, he'll speak to his role, but he'll also help you navigate some of these services as well. All right, Debbie, I turned off the sharing if you're able to reshare yours.
Thank you, Megan. And thanks so much for the reminders about Bridge the Gap. And we hear about it all the time. I say it just about 10 times a day, certainly to people that I speak with. But it's a great reminder of the so many resources that are available. And as you spoke about, this is these are resources on the continuum of care, right? So they're not going to be what everybody will need at all the time, but there's a lot of resources there that people can access 24/7, wherever you live in the community, in the province, and so helpful. So thank you so much for that great overview. I'm going to turn it over to Barry now to talk about his role as the Provincial Navigator, but also to share some other resources that are available for mental health and addictions.
Hi. Well, thank you so much for inviting me. Actually, I guess a lot of it's just starting out. My name is Barry Hewitt. I am from Newfoundland and actually lived in most places around Newfoundland. So I kind of know many parts of the province, and actually I always enjoy getting to know people from different parts of the provinces. So I'm very inquisitive, and I usually like to talk and engage with people. So if you ever see me, feel free to stop and have a conversation. You want to go to the next slide? Mainly, my role is I am the Provincial Systems Navigator for Mental Health and Addictions. And all those there, they cut it really short and sweet, is that my role is to know every single mental health and addiction resource in Newfoundland, Labrador for the health authority and community. So no matter where you live in the province between Nain and St. John's, if you call me, I can tell you exactly what's available, how to get access to it. And more often than not, I can probably tell you the personality of the person you're actually going to be talking with. But the other part is I'll actually take the time and actually talk to you about what's actually happening, where's the best way to direct you. Because we have a lot of wonderful resources in the health authorities, but there's a lot of wonderful things happening in the community. And it's important to understanding what's available to you and how to get access to it And when should I get access to it? Because sometimes it's about starting at the right level as much as, getting you to it, immediately. And the other part is the people who normally call me, it comes in three categories. And usually the categories are people that are, professionals call me all the time. So they'll call me from doctors, other offices saying what's available, what's in the health authority. I heard about this program. How do I get access to it? I get a lot of family members or friends calling me saying, I have a loved one, I'm worried about them. What do I do? What's available for them? Or they call me, this just happened. What do I do now? So it's more of a crisis driven. And I get a lot of phone calls from parents about their kids. I'm worried about this. What do I do? I get a lot of calls from, I guess, kids talking about their parents. Mom's doing this now. Is this worrisome? What should I do? And the last part is I get about 1/3 of my phone calls directed from people looking for services, saying, I'm upset, I'm concerned, I'm worried. Where do I start? What options do I have? Where do I have to talk to my doctor? Yes, no, or where do I even go? So I get a well-rounded, a lot of people call me on a regular basis. And like I said, because my role is to know all the different resources, I can help guide people. But I also kind of took it upon myself to kind of know all the other systems that connects to mental health and addictions. So whether it's housing, financial assistance, you're talking about seniors, you're talking about pensions or anything else, usually I either know the system or I know how to direct a person through that system. Because trying to understand all the things and how they intersect and connect can be quite complicated. So I try to help people work through that part. And the last part of my job is that if a person contacts me directly, it puts me in their circle of care. And in their circle of care, a lot of times I help people, I keep saying, getting lost in our system. It's not a word, but it makes perfect sense. So I can actually, with their permission, actually go ask questions to the health authority, see what happened, was there a referral made, or how come they didn't hear back from someone, or what's actually happening. And so I help guide them through the system as much as getting connected to the system. So that's my role, and I'm it for the entire province. So if you ever have a question, and I keep saying, I keep wanting to be famous one of these days, mainly because I want to be famous, like just by knowing one name. You have Cher, you have McDonald's. So, in my case, it's like, just call Barry. And it's a great little slogan, just call Barry, because if you have a question about anything related to mental health and addictions, that's what you just do. You just call me. And now that you actually see my face, you're more likely to call me than if we just gave out, information saying that we have a navigator. Because in Newfoundland and Labrador, we're very good on visuals. And the other part is we're really good. And once we know a person, we're more likely to reach out to a person. Because it's amazing the number of people after I give a presentation, I get a phone call the next day going, I was talking to my neighbor, they seen you present, and they told me I had to call you. So feel free at any time to reach out. As you can see, mainly I work Monday to Friday, 9:30 to 4:30, 8:30 to 4:30. And the other part is usually I try to get back to people within 24 hours. I spend most of my day on the phone or on email, and actually I connect with people as soon as I can, because I know a lot of times when people are calling me, they're in hurt, they're pain, or anything else. So I will take the time, I will walk you through everything and anything. Next slide. Okay. One of the main systems that we have and getting people connected fairly quickly is Doorways. Doorways is meant for immediate access. So if you want to talk to a therapist today, you talk to a therapist today. It's meant to be a single session or brief therapy, so maybe 1 or 2 sessions at most. It's done by drop-in or it's done by appointments. Right now, before COVID, it was more drop-in. Now with COVID, they want you to call first. And the people, staff that are all your clinical social workers, they're all psychologists or addiction counselors. And a lot of it though is more about if you're having an issue right now that you're totally confused and you're messed up and I need to talk to someone just to get clarity about what do I need to do because I'm upset, I'm worried and all this, Doorways is a great place to start because it gives you an opportunity to meet with a therapist about what's happening in your brain, where do I go, how to organize your thoughts, and you walk away with a plan. How do I take care of this? Or if necessary, they can actually help refer you on to the next level. Okay, next step. Mental health and addictions. It's a very broad area, mainly because all the different regions have a different access point. Because if you live in St. John's, you pretty well got central intake. Outside of St. John's, you call them, different offices. Central Health, you get a different process. You have one number for all central health. Western, you call the individual offices, same with Lab Grenville. So depending on where you live, access is different based upon how you actually reach it and how you do it. And within all the different health authorities, also, one important part is you can make your own referral for every single program, for any mental health program besides psychiatry or eating disorders. So anytime people say, oh my God, I got to go see my doctor so I can go see a counselor. No, you can call yourself. It's that simple. And all you need to do is when you first call is just say, you don't have to get into big elaborate things with, right away. When they do your intake, you tell them what's happening. But initially just say that right now I want some counseling. Because a lot of times initially people want to explain all that stuff. No. All you need to do is say, here's my name, here's my number. I want some counseling. When they do their intake, you give more information. So then they can best direct you to the best services. Because behind the door, we have a lot of different, we have trauma programs, we have DBT, dialectical behavior for certain type of things. We got certain groups, we got addictions, we got traumas. So you name it, there's a lot of different types of programs in different areas and how to get access to it. All you have to do is reach out and ask, and we can help get you connected. If you don't know where to start, that's when you call me and I can help walk you through all the different processes. For the health authority community, I walk you through Bridge the Gap. I'll encourage you to call channel. So I tell you about all the different parts, how to get access to it. And also usually I'll send you an email afterwards with all the information because there's a lot to take in. And that way you get a chance to look at it slowly in your own time. And also starting coming up in March, most people can actually support all the different services that we have by going through your 811, going through doorways, or going through Bridge the Gap, because we want to make access as easy as possible. And that's the biggest part, is how do we get people connected? Because they keep saying right now, 1 in 5 people have mental health and addiction issues, 1 in 5. If you think about that, that's 100,000 Newfoundland Labradorians, 100,000. And out of the 100,000, most don't reach services. Some because of stigma, but some don't know, how do I start this? It's overwhelming. Where do I even? So we're trying to make it as simple as possible. How do we get people connected? Because once you get connected, then you understand process, and then there's opportunities. How do we actually guide you through better mental health? If you need to see a psychiatrist, that's different, because the psychiatrist is a specialist, no different than a cardiologist, no different than any other specialist in the hospital system. You need a doctor who says, yes, you need to see a specialist. Actually all family doctors at any period of time can, and I will let you know, can write prescriptions for medications. They can actually start your treatment right away for if you do need medication. They have ability to do an e-consult. So they can actually consult with a psychiatrist about you. Where should I start? What can I actually do? And then if they think you need it, then they can make a referral for psychiatry. Eating disorder, it's a whole different thing. You need a physician, make a referral for that part. And we do also have inpatient treatment programs. And that's, for eating disorders, we have one there, but that's all, again, through specialists. You want to go to the next slide? For addictions, we also have a lot of specialized services for addictions. Like number one, we have a detox, a medical withdrawal management center called a recovery center. It's a great place to go when you come out of drugs or alcohol, especially alcohol. Alcohol, is one of the actually most dangerous drugs to come off unassisted. And the other part is when you're there, it's about safe withdrawals. So there's no harmful effects, but also when you're there, they'll also do an addiction assessment and they'll connect you to services when you return back to your home community. So you get in, you're safe withdrawal, you're stabilized, and then you're also educated and referred back for services. We also have opioid-dependent treatment hubs and all across. So no matter where you live across the province, you can get opioid-dependent treatment. And a lot of times that's more methadone and Suboxone. And that's for people who actually have their addiction to a narcotic. It only works with narcotics. It doesn't work with cocaine and alcohol, but there's an awful lot of narcotics in their communities. And it's a great treatment option for people. And because what it is, you give them the medication, and the medication creates stability. So then they have the chance and opportunity to make lifestyle changes. That's what methadone and Suboxone does. Gives people opportunity to make changes in their life and get connected services. We also got a concurrent disorders program here in St. John's. It's specialized in dealing with people with mental illness and addictions. But there's also many clinicians that are trained across the province that can actually do the same work. So just because we have more people in St. John's that create a program for it, doesn't mean that you cannot receive the same services in other places. We have 2 inpatient treatment programs in the province, one in Hubbardwood, which is in Corner Brook, one is at the Grace Center. Mainly the biggest part is most people don't need inpatient treatment right away. They may need it, they may not, but it's important to get them connected to a therapist and to a service to see what they need. Because a lot of times family members, it's about fear. And oh my God, I just found out we got to put them somewhere, give them treatment and just lock them up for 4 weeks or 6 weeks and just take care of them. They may not need that, but they may need treatment. And so a lot of that initially is getting them connected to services, connecting them to the help. You're going through detox, going through the outpatient counseling, going to the self-help programs. There's a lot of wonderful self-help programs in the community. And then if necessary, then they may actually need an inpatient treatment program. But part of it is taking the first steps to getting people connected, because you don't need to start with the most intrusive if the least intrusive is going to work. And the other part is, we also have the SWAP program, which is the Safe Works Access program. That's about needle exchange and things like that. There's a lot of people currently using, and from a harm reduction model, our part is meeting people where they are. So SWAP, what they do is they'll actually help people get clean needles. And so that the risk of HIV infections, hepatitis C and all that, it's much, much less than what it used to be. The U-Turn Drop-In Center is actually out in Harbor Grace. Jeff and Tammy Bourne running. Absolutely wonderful people. It's a peer support model. So when you come from a peer support model, as Brad talked about earlier, it's a different level of understanding than what a clinician does. They understand and connect with people on a different level, and people can actually truly relate where they are, and they meet people where they are. And actually, it's an amazing number of people I send from around the province to go connect with Jeff and Tammy, because it's worthwhile the phone call or to drive out there to have the conversation, because they provide a sense of hope and understanding, and that it really works well. The last part is we have AA and MA around the province. We also do have GA. Not as prevalent, but AA, like if you ask me what's in St. John's, there's about 10 to 12 meetings every single day happening here. So a lot of what I do is from the mental health and addictions is understanding what the parameters are, and I'll connect you to what's available in the health authority. I'll talk to you about what's available in the community, and also where are some best places to start from an access point of view. How do I get access? What do I do? But also when I work with family members, I also tell them about resources for them, because there's resources for family members as much as the person, their loved one. So I'll talk about them and how they're doing and coping. And I'll talk about doorways, how that can work for them. Or is there counseling? Is there education sessions? Is there support groups? So I'll walk them through all that, and then I'll kind of guide them through all that part. So when people don't know where to start, then starting with me sometimes is a good part too. Next slide. There you go. I guess that was my presentation. I never knew how much I put in there. For those of you, actually, I just want to point out that there is a Joey Smallwood in my office. And the reason being, and actually I always like pointing this out, because right now, actually, see, Joey was a god to my grandmother. My grandmother used to own a hotel, and the reason I'm telling the story because we're hospitality. And she loved Joey because Joey came one day and he brought us salmon, and he gave it to my grandmother saying, "This salmon I want to give to you because I really appreciate everything and all that." Ever since she did, he did that, Joey was God. And Joey was in the center of her room, and all of us grandkids' pictures and everything else went around Joey. And Joey would never come out the wall because he was God. So when my grandmother passed away, actually I took Joey, because actually it kind of reminds me of my grandmother, but also the fact that no matter who we are, we should appreciate every single person and the things they do for us. And it kind of keeps you more grounded and actually appreciative of all the things people you do and actually anyone I run across. So thank you for the time. Now that you see my lovely face, you know who you're calling, and that hopefully you do get a chance to reach out. And if there's anything I can do, I will definitely do it. Thank you.
Thank you, Barry. I didn't need the slogan, just call Barry, because I do that all the time. And I always appreciate the time that Barry has and his knowledge, as he said. He truly does know from all across the province. And I'm going to say name to Trepassey. I'm a bit biased there, but just not named to St. John's. So just call Barry for sure. One of the things I'd like to add to is around our wait times for some of the services that Barry spoke about today. Some of these services are available without a wait list. You can call a recovery center, and depending on who's there and what their capacity might be, and sometimes that's affected by COVID, of course, but you may be able to access that service same day or next day. Same thing with the opioid treatment hubs across the province. They are all offering a same day or next day service for people, and that is a huge improvement over where we were just a few years ago, where people may have had to wait months for that service. Programs like the Grace Centre in Humberwood would have a longer wait time, but as Barry said, there's other services that people can do as they're waiting to get into those services. And I guess it's really important too, given that Hospitality Newfoundland Labrador spans the whole province, that so do these services. Programs like community programs like Channel, as Brad mentioned, are all across the province. And so are things like the Safe Works program, that harm reduction service that's offered by the AIDS Committee in Newfoundland Labrador. They have offices and satellite sites in other parts of the province too. I always like to say, one of the silver linings behind COVID has been the increase in virtual care, and that being able to offer that, and meetings like AA or NA being offered online from anywhere. There's a number of people who probably never would have walked into an AA meeting, but they're participating quite actively online. So again, we'd like to look for a silver lining behind COVID for sure. I'd like to really thank and give great gratitude to Brad, Megan and Barry today for their presentations and for sharing resources with you. I know that all three of them had a lot to offer. Some of their sessions have been condensed down to 20 minutes from a couple of hours or even longer sessions, and they did it so well, and I'm so grateful. Thank you so much. Please note any of the contact information that would be available on Bridge the Gap, and that's available of course 24/7, and some of the services, as Megan talked about, would be available at various times. We really hope that today's presentation helped you to provide information for not only yourselves and your own mental wellness, but those for your families and for your staff. Mental health and addiction services in our province have grown a lot over the last 5-10 years, and that is because of the reduction in stigma, but also the recognition of the importance of mental wellness to our health overall. We continue to strive and are always working to provide that evidence-based care to help people where they need it, when they need it, and closest to their home. So after today, please feel free to reach out to any of us if you have any questions or concerns. Our contact information is available here. And I think what we're going to do now is stop the recording and take